My name is Lisa Schacher, and I am an RN in Gritman Family Birth Center. I also grew up in the area, grew up in Potlatch, live in Genesee. So what's really great is I get to encounter a lot of the people that I've met through those experiences in the Family Birth Center and get to take care of them, which is a really special thing for me and for our staff. As a nurse in the birth center, I have been part of over 500 babies being born, and that really is just a blessing for me. And that really pushed me towards wanting to help with our patient education. And so I teach the childbirth education classes where we have partners come in and learn about pregnancy, we learn about the labor and birth process, what's going to happen during that time, but we also learn about newborns and what to expect and how to care for them, and we learn about what happens in postpartum and recovery, those first 6 weeks at home. We also do a refresher labor class, and these are for our moms that maybe have had babies years ago, but are looking to see what the new information is and what the updates are. So we offer that. For all of our moms, whether it's their first baby or not, we do something called a pre-clinic, and that's where we have them come in and we really sit down and talk about what their birth plan is. We talk about all the important information, the paperwork, the things that they're going to encounter for their treatment and their care during their stay, and that really offers them the opportunity to ask any questions that they might have, and we can do a tour of the Family Birth Center during that time. We really encourage a birth plan, especially for new parents, because it really sets them down and opens that line of communication between the partners, and so they know what their wishes, what their desires are. When we have our patients come through the childbirth education class, we give different samples of birth plans they could fill out. We get it written down, kind of a simple version and then a more detailed version. We also want to share that with our staff. With that in mind, we have to know that sometimes things don't go as planned, and here at Gritman, we really pride ourselves on having the equipment that we need to be able to handle those kinds of situations. We also do a sibling preparation class, which is really fun to teach, where we have the little siblings come in and they get to hold baby dolls and they get to talk about what babies eat, and we do a tour of the Family Birth Center. We have a couple lactation consultants, and they can see our patients as they are in the hospital, and they can follow up with them if there's any concerns after the baby's born. We also have certified car seat technicians. We will do a car seat installation check, make sure that everybody is safe, especially as they're going home with their baby. We do something called a post-clinic. When you go home with your baby, we have you come back about 2 days later, and we just make sure that everything's been going well since you've been at home. We want to make sure that mom and baby are both doing well, that breastfeeding's going well, that baby's not losing too much weight, there's not too much jaundice, all those kinds of things, because we really want to help and support our families as they make that transition from hospital to home. We are doing a follow-up phone call program where, especially for our first-time parents, we are calling them at 1 week after baby's born and at 3 weeks after baby's born. And that really just helps make sure that they're settled in home with their new baby. And then for the 3-week phone call, we're really focusing on are there any issues with postpartum depression? And then we also have a mom and baby group, which is just a fun group for moms to bring their babies to and interact, get out of the house, ask questions. We're really talking a lot about sleep, a lot about parenting, a lot about those normal questions that you have as a new mom. The way that we have our unit set up is we actually have one side that's focused on labor and delivery, and that's where our birthing rooms are and our nurses station. And then the other hallway on the same unit is where we have the postpartum rooms, and that's where we have our moms and babies and families that are recovering and getting ready to go home at some point. We do have a lockdown unit, and that means that our facility is locked 24 hours a day, 7 days a week. And that really just is for the safety and security of our moms and babies. And that also helps us to regulate visitors when mom and dad are wanting visitors or they're wanting to have some quiet time. I think what's really special about the Family Birth Center is the fact that all the nurses, all the CNAs, all the staff that work there, we really are a family, and that just creates this environment full of love and compassion and gratitude for what we get to do.